Hello, friends. Ever consider we may be in a state of malnutrition? The lack of wholesome meals are major contributing factors towards disease and behaviors, just like oil and gas to a working vehicle. Not to mention lifestyle are very real considerations. After 20 plus years of listening, surveying, observations, and hosting retreats, I interacted with many patients and their families. I myself was a patient overcame 3 major health challenges. My experience and insights will help to equip you, my audience, to unpack and eliminate guessworks before you visit your doctors. Welcome to my show, Optimize Wellness and Maximize Life by way of 1 degree change. Hello, this is Mary Axness again on episode number 5, and this is season 2. Welcome. I'm excited to delve into the potential benefits of vitamin D, why we need them, how much we are misunderstood when it comes to the family of vitamin D. Now, there's oftentimes people are saying, well, if I go out in the sun, why would I need to take vitamin D? Actually, vitamin D itself is very much misunderstood. And I want to give a broader understanding how we receive vitamin D, how our body needs them, and how vitamin D actually helps a lot of food, nutrients, other nutrients to get absorbed, especially the liver. Now, I have people says, well, I took vitamin D, and why is my vitamin D level still deficient? Sometimes it show up in the nutrition test, and sometimes it doesn't at all. And so we need to understand the what, the why. Now, if in the summertime you are getting good quality of sunshine, when I say good quality, I am talking about a specific time during the day that the vitamin D that you can absorb into your skin, through your skin, it actually does not take a long time, which means you do not need to just lay out in the sun and burn. And there are dangers in that. A lot of people that live in the southern hemisphere, like globally speaking, if you live in very hot tropical climates, you really don't need to be sitting out in the sun, and not to mention sunburn. And we all heard about it. Sunburn can cause damage and may even get cancer, especially skin cancer. And there are a certain group of people that can be susceptible to it. But here we're talking about, why do we need to supplement vitamin D? So in the summertime, in the northern hemisphere, in the US area, summer's coming, and we need to get all the vitamin D we can. When I say there's a specific time, the best time to take vitamin D is around noontime. And because you don't need to be sitting out in the sun the whole hour, 2, 3 hours, like you go to the beach. With the wind and the sun, our especially lighter skin friends, they get burned. And when you get to a place where your skin peels, there is damage. And hopefully it's not accumulative damage. Now, people that live in Florida, where the sun is very intense, or close to the Gulf of America and the southern side, you be careful the amount of sun you get. So when I say noon, the most you should get is 15, no more than 20 minutes. Anytime when you get more than 20 minutes laying out in the sun, you're getting way too much. And also, that's the best time to get the quality of vitamin D absorption into your skin. And I have a lot of people ask so many questions about the D and sunscreen. And we're going to talk a little bit about it today, about sunscreen. Now, personally, I advise everyone to put sunscreen especially on your face, because for women, the overdoing with the sun, it really makes your skin very thick, and also potential damage such as skin cancer around your face and the neck and the chest area. So you would see Asian women always carry an umbrella. You still get the sun, even if you're not directly under the sun, because of the ultraviolet rays. And in certain cosmetic, they will rate it called PA plus. There is a reason cosmetic company put that in there, whereas in the US, we don't see that differentiation because there's different system. In Asia, we have what we call the ISO, established by Japanese skincare company, because Asian people have very fine porcelain skin, whereas uh, Caucasian, especially American blonde people, they cannot handle the sun direct, especially on the face. And of course, we can tell on the top of our shoulder, the back of our ear. That's why it's important to wear protection. I have a big wide brim hat, especially when I work out in the garden. And why we want to talk so much about vitamin D, I want to give you a lot of information, but some you really just need to listen to it. As far as application, the 1 degree, what do you do? We'll talk very specifically what you do with vitamin D and even sunscreen, especially for the face. We women are very conscientious about our face and not aging it faster than we need to. So I want you to watch this special testimony that I'm so excited, always sharing, almost day and night, how I got healed from a serious concussion head injury where the frontal lobe was so damaged that I couldn't talk. And I would be looking at people. I see their mouth move, and I wasn't able to understand what they're saying. That was a head injury. It took almost 9 years to recover. Well, actually, it was 2 years, but the 9 years thereafter, I realized what I have lost, and I am making up for lost time. So, watch this, and how, even though I'm over 70, my heart is young, my mind is good, and why not show up as our shows talk about? Let the best version of yourself show up. So watch this. Hi, Dr. Mary Axness here. At age 72, I finally retired. And guess what? I wrote a book. It's called Optimize Wellness and Maximize Life. And you know what? God healed me from 3 major medical challenges. One of them was a serious brain concussion injury over 10 years ago. And the doctor said there's nothing they can do other than just sit on the porch and rock. That didn't sit well with me at all. So I do what I knew best to do, eat myself back to health, plus co-labor with God, and did a lot of study and understand how to feed the brain well and recover. Now I can say, order this book. I'm going to have classes over this too. And come along and grow young with me. Retirement is just a new chapter. Well, welcome back. I hope you enjoyed that story or testimony. God really did heal me. And like I said, the last 9 years, it was gradual, but I am excited to not only make up for lost time, I want everyone to come up to the plate, live life longer, stronger, healthier. Now, back to vitamin D. There are so many exciting things about it, and I do have to get back my book and just to read up a little bit again. Every day, I do encourage you to take vitamin D. And vitamin D is absorbed best when you have a fatty acid to go along. And I take a vitamin D plus from a company. Not only does it have D, is the kind of D I call D3. If you are familiar with vitamin D, there are D2 and D3. Right now, we want to make sure we talk about D3. Is a type of D that really works well for the liver to absorb. And many folks out there, their liver health has been compromised. I always try to make it very simple. The liver is your processing plant of the whole body. Whatever you eat, there are enzymes in your liver that will help absorb the D. And the best form of D is called D3. Some people already know it because internet has so much publicity about getting vitamin D, especially women at any age after 20s. You have to have D3. And then when you're post-menopause, D3 comes in even much needed. The constituent of D must have also K2. So we're not getting complicated, but I want to make sure you know the bone density as well as our skin health is tied together. So when you take a vitamin D3, it's good that you combine it with what I call vitamin K2. Vitamin K2 is also a superior form of K and is called minoquinone, and they call it number 7. And vitamin K is a form of fermented supplement. It's coming from a Japanese, many Asian and European families. We are so used to eating fermented food. We don't take antacid after every meal. But in between meals, we take fermented foods. And I have people ask me, what's fermented food? For Korean people, we call it kimchi. For Asian Chinese people, we call it the miniature spicy tofu. And it comes in a jar with about 20 square, and you just wipe a little bit. It's very salty. It's been fermented from soybean, and you put a little bit of it in your soup or in your rice. And it's not meant for you to eat, but is to complement with a lot more flavor. But it also helps your digestion. That's the main reason. And when you have vitamin D combined with K2, guess what? You have a very absorbable form of D that your body can use and is gentle, and your liver would love it. And many people, unfortunately, they have compromised their liver, cirrhosis, alcohol. I don't want to talk too much about the liver today, but your liver really appreciate vitamin D3 and K2 combined. And the other benefit of putting K2 and D3 together, I have to say, be sure you take a certain fatty acid. Um, if you have flaxseed oil or a few drop of a little half a spoonful, maybe even less, of coconut fat, coconut butter, when you take your D3 and K2 together. It's not complicated at all, but when you go to the doctor and they say, well, you have bone density issue, that's when you would say, well, what do I do? They will always advise you to get vitamin D, um, up to 5,000 international unit. We as a nation in at least United States, um, we have such a deficiency in vitamin D that doctors have to exaggerate it. For myself, I do have bone density issue, especially post accident. I had a lot of bone fractured on my ribs, and that's when I need to double up on my D. But it's good to get tested. Now we have people, when they go to the doctor and the doctor says, well, you have a bone density issue. Number one, there are tests that on your left hip and your right hip, and sometimes it will show up. It's not just the hip, but the whole bone structure. Because when people have bone density issue because of vitamin C deficiency, guess what? They will ask you not just supplement extra vitamin D, they will also introduce you to a newer kind of treatment to avoid thinning bones, and eventually it may get you to have your spine uh, rubbing on each other because your disc is not replenished with the proper D and K2. And I want to also emphasize the absorption of it. For the longest time, even as a naturopath, I wasn't taking fatty acid along with my vitamin D. Now, I was already feeling really good, other than the episodes that you saw. Excuse me. I realize people don't understand why they need to go out to the sunshine, and children need to play out in the sunshine, play in the dirt, stomp their rain boots on the puddle. Those are activities that drive us outside, getting fresh air, getting sunshine. It is vital, especially women our age and postmenopausal women. Our bones do get brittle. And the next thing is we are lack of calcium also. Well, if you take D without calcium, it will not absorb and be effective for your body to utilize. So, what are we talking about? We're talking about D3, K2, calcium. And why are we having calcium deposit everywhere else but where is needed? Let me give you an example. My husband recently have had to endure uh, a serious long-term neglected, I have to say, rotator cuff, shoulder cuff injury. But really, it was so ignored that he actually discovered he should have taken care of it when he was in his 30s and 40s. Well, he's 70. Well, guys sometimes they just don't take care of themselves like we women. They are not well aware of themselves. Why people waited too long and not realizing it, and then pretty soon they are unable to have full range motions of their cuffs, of their rotator, the shoulder cuff. I am going to ask the ladies on this show to alert to your husbands when they take calcium and even vitamin D and even with K2. There's one other element that the calcium is not absorbed. Calcium is needed everywhere, not just the bones, but the ligaments, the joints, the fascia. Fascia, uh, not everybody know what it is. Remember that when you have a piece of chicken breast and you see a very shiny piece of sheen, glowy material, that's fascia. Fascia is that very fine sheet of fine ligament that actually holds the muscle together. Vitamin D will supply it, the nutrients to keep it, and so that your muscle is staying stronger and more intact. Another thing why we need to pay attention to calcium. Without calcium, vitamin D has a hard time getting into our cells, getting into our bone, ligaments, joints, tissue absorption. So, what are tissues? They're not muscles. Tissues are the artery, the walls, uh, the different layers between your dermal, the skin underneath the skin, lots of tissue holding this body and letting it do its work, play, work, cook, uh, outrunning. This is a very incredible machine. So, I want to talk just a little more about vitamin D. And next week, I want to introduce the family of vitamin B. They are very significant, and all things work together for the body's good. So it's not just one and done, it's not one without the other. And I have so many fun illustration that people, when they don't take enough vitamin D and when there is deficiency, long term, you will get the result of a disease. So, we are talking about vitamin D, and part of the time I was talking about the sunscreen. If you go out in the sun, try to make sure your face is protected, men or women. Also, if you're from a subtropical like a climate like me, it is important to get a sunscreen that actually SPF 30 and above. Um, Also, I have introduced this label called PA, is really PABA free and also is colorless. There's so many choices out there. And because I had postpartum cystic acne, my face was all scarred up because the PA rating on the sunscreen label was missing in US products. So, for extra protection, um, this was developed by the Japanese. Uh, Anytime when there's a 1 plus and then 3 plus, is actually the grade of the UVA, the way they calculate how the sun ray penetrate, and actually is a protective label to say PA plus plus plus. That means it protects from the penetration of the uh, sun UV ray into the skin, the dermal layer, which actually contribute to skin cancer. So now, when people go out in the sun, anything longer than half an hour, whoa, you do need uh, sunscreen all over. Now, some people say, well, I sit out there and I'm getting all my vitamin D. Well, you have to be very careful, especially the um, the degree of your skin pigment. And dark skin pigment people, they don't get as sunburn as much. However, they also get thicker skin, so they look like they don't age as much. But once they get too much sunshine, overly doing it, it will show signs of premature aging, and it may not show directly on the own uh, area. However, it always shows on the hand, the sunspot, uh, and also the uh, decollete. Back to vitamin D. Back to vitamin D. I realized that I haven't finished what I was talking about. When the blood carry the blood calcium in the blood, when it's not carried out into the tissue, we're missing one thing. It's called vitamin F. Vitamin F is a delivery system. I call it the transport system. It will take uh, vitamin D and K2, transport them from the tissue to the blood, or from the blood back into the tissue. So there is an exchange here, and we call it the transport system. So for me, when I take vitamin D, guess what? I take vitamin K2, D3, a little bit of fat, and a vitamin F. All you need is a little bit. Then the blood calcium, the D absorption, it will transport with a quality of distribution all over the heart, the arteries, and the blood carrying calcium will not deposit and build up in one area when it should be feeding the heart. I talked about guys when they overuse their cuff, their rotator cuff, um, because especially little boys, even if they're in pain, they'll go out and have fun, and they keep re-injuring their joints and shoulders and kneecaps. One of the reasons why they don't get healed, and when they get to old age, many of them have to have joint and shoulder cuff surgery, is partly because calcium is not getting to it. And another reason is to get blood flow. Our circulatory system isn't doing so well. So, guess what? We need um, oxygen and blood circulation working well for the transport system to go all over the body so people don't have over deposit of calcium in one area or the other. And also when you people go out in the sun and get severe sunburn and then they get welts built up, it is just very itchy and it's like a hive reaction from sun. That's usually because they are not taking adequate vitamin F, and that's our transport system. Now, children are not aware of these. I am asking the adults to pay attention when you see little children. They are not hydrating well, they get too much sun. You do not need to give them as much. You can cut down on their D3. And especially children that have certain uh, propensity to cancer, we are seeing more children diagnosed with cancer at a younger age than I've ever seen before. And that's another topic. But until then, I want to tell everyone how grateful that you are here. And I want to make sure I leave with praying and thanking God that we have today. Every night, I encourage everyone to meditate and count your blessings, that all the stuff that you have been avoided, that you've been protected. I really believe there are angels and camping all around us. So I want to pray and meditate and share. Thank you, God, for taking care of us so well. Every night, we can go to bed, count our blessings that we can eat, sleep, poop, pee, sweat, and get sunshine. And so I welcome you joining us next week. We'll be talking about the importance of understanding vitamin B and all the complex and the vitamin B family and how you can be wise about choosing your Bs. Until then, you only have today, and I wish you the very best. Summer's coming. Get plenty of sunshine. We'll see you next time.